There has been a concerning increase in pneumonia cases among children in the Netherlands, coinciding with a surge of respiratory illnesses in China. According to the Netherlands Institute for Health Services Research, last week saw 80 out of every 100,000 children between the ages of 5 and 15 being treated for pneumonia. Additionally, cases among children aged 4 and under rose from 124 to 145 per 100,000. This is the largest outbreak of pneumonia recorded by the Utrecht-based research institute in recent years. In comparison, during the peak of the flu season in 2022, there were 60 recorded cases per 100,000 children in the 5 to 15 age group. Both NIVEL and the National Institute for Public Health and the Environment in the Netherlands are unable to explain the sudden increase in pneumonia cases among children. It is unclear whether this trend in Europe is connected to the rise in respiratory illnesses in China. The World Health Organization and Chinese health officials have stated that no new or unusual pathogens have been found in the pneumonia cases. The surge in illnesses in China has been attributed to children contracting known viruses such as the flu, rhinoviruses, the respiratory syncytial virus, and the adenovirus, which they had avoided during the COVID-19 restrictions. China lifted its strict lockdown rules at the end of 2022, marking the first post-COVID flu season in the country. Medical experts in China believe that the lack of exposure to common viruses during the prolonged lockdown may have weakened the population's immunity. In the Netherlands, however, COVID-19 measures have been lifted for a while, raising questions about the cause of this new surge in childhood pneumonia cases. Disturbing videos showing overcrowded hospitals in Beijing and other parts of northern China, filled with sick children and their parents, have raised concerns worldwide. The WHO has publicly requested Chinese health officials to provide data on clusters of pneumonia cases, which have been found to be caused by known viruses. Maria van Kerkhove, acting director of the WHO's Department of Epidemic and Pandemic Preparedness and Prevention, stated that they have asked for comparisons prior to the pandemic. The current waves of pneumonia cases in China do not reach the same peak as those seen in 2018-2019, indicating that this is not a novel pathogen. This is a situation that most countries dealt with a year or two ago. Given China's previous mishandling of the COVID-19 response, questions have been raised about whether the government is covering up the initial stages of another pandemic.